announced that New Jersey has tapped outside firms to begin a long-promised review of how the state responded to the COVID-19 pandemic. 2 years and 9 months after the virus began spreading here, NJ Advance Media has learned. The independent review will be conducted by a team at Philadelphia law firm Montgomery McCracken Walker and Rhodes, led by a Republican former Assistant State Attorney General, and a report will be released in late 2023, the governor's office will announce later Monday. 2 years and 9 months after the COVID-19 pandemic started spreading in New Jersey, Phil Murphy will make the long-promised announcement that the state has hired outside firms to start a review of how it handled the situation. This is according to NJ Advance Media. The independent review will be carried out by a group at the Philadelphia law firm Montgomery McCracken Walker and Rhodes, led by a Republican former Assistant State Attorney General. The governor's office will make the announcement later on Monday. Help will be provided by the Massachusetts-based management consulting company Boston Consulting Group. In April 2020, just a few weeks after COVID-19 started to spread in New Jersey, Murphy made the initial commitment to carry out a post-mortem on the pandemic. The Democratic governor has repeated those plans numerous times since then, claiming last month that it has taken longer than anticipated. Republicans have chastised him for the delay time and time again. New Jersey will, according to Murphy's office, be the first state in the nation to order an independent and comprehensive review of the pandemic. The estimated cost to the state of the review was not disclosed by his office. The state's management of testing, immunizations, personal protection equipment, and other issues will also be examined, according to the office. This includes how it dealt with vulnerable residents who were in long-term care. Additionally, it will offer suggestions on how the state can prepare for upcoming public health emergencies, according to the office. In a statement obtained by NJ Advance Media, Murphy said, "The COVID-19 pandemic was one of the biggest challenges our state and nation has ever faced. Throughout the pandemic, it was my duty as governor to base every choice I made on the data, information, and science at my disposal in order to protect the health and safety of all 9.3 million residents, regardless of the political climate. In order to take the necessary steps to better prepare future administrations for a public health crisis, it is also my responsibility as governor to conduct a thorough and in-depth review of how the state was prepared for and responded to the pandemic." The review will be overseen by Paul Zubik, who served as Christy Whitman and Donald DeFrancesco's first Assistant State Attorney General. He now works from the Montgomery McCracken Walker office in Cherry Hill. After the terrorist attacks of September 11, Zubik also worked for the State Department of Law and Public Safety. He has presided over numerous investigations into state government and the September 11th terrorist attacks. Paul Zubik is the ideal candidate to head this review because of his experience in emergency management and government investigations, according to Murphy. He is a well-respected, nonpartisan, and seasoned state and federal prosecutor. The review could help save lives in the next crisis, Corrado, a Republican from Passaic, said in an August letter to Murphy criticizing him for not having set a release date. Murphy stated on Monday that although COVID-19 is still present, the state has transitioned from a pandemic to an endemic phase, and now is the right time to undertake such an independent review. To commission a review while we were in the thick of it, a senior Murphy administration official told NJ Advance Media that it probably would not have been possible or responsible. The official spoke under oath because he was not authorized to publicly discuss the situation. Since the first case of COVID-19 was reported in March 2020, more than 35,093 people have died in New Jersey, a state with a population of 9.3 million and an early epicenter of the pandemic. According to state statistics, more than 9,800 of those fatalities occurred among people receiving long-term care in nursing homes and other facilities as well as among those working there. On Monday, the state announced 976 additional COVID-19 cases as well as 10 deaths that had been confirmed. To help stop the spread, Murphy shut down shops and schools statewide for months. But he has repeatedly come under fire from Republicans and other groups for enacting laws that were too severe, as well as for the deaths that occurred in long-term care facilities. State Senator, a Democrat, a bipartisan committee to look into what occurred in nursing homes has been requested publicly by Nia Gill of Essex County. In August, the state consented to pay 71 families of residents who perished in New Jersey's 3 state-run veterans' homes in the early stages of the virus a second round of settlements totaling $15.9 million. The families of 119 residents who passed away from COVID-19 in veterans' homes between March and May of 2020 received nearly $53 million as part of an earlier agreement in December to settle wrongful death claims. As part of either settlement, the state denied any wrongdoing. The announcement on Monday comes a week after the Murphy administration sent a team of long-term care experts to the state-run Veterans Memorial Home in Menlo Park to assist in addressing abuse issues and safety violations that were discovered in a recent inspection and put residents in immediate jeopardy. A week prior to that, the The administration was informed by the Centers for Medicare and Medicaid Services, or CMS, that funding for new admissions may be withheld if serious flaws in resident care and pandemic infection control are not corrected. In 2020, as the death toll grew out of control, the Murphy administration hired healthcare consultant Manat Health to look into how nursing homes in New Jersey handled the pandemic. New Jersey was compelled to request U.S. emergency aid. The Veterans Administration and the National Guard made changes that were criticized as being too little, too late. The consultants came to the conclusion that long-term care facilities were generally understaffed and unprepared to handle the pandemic, and they called for stricter state oversight. However, the study did not evaluate the state's performance. Your assistance is required for our journalism.